Welcome to Lean Forward, the Lupus Education and Advocacy Network program of the Lupus Alliance of Upstate New York. This video is part of a series created to inform and empower those affected by lupus and related autoimmune diseases. This program is for every lupus warrior, loved one, caregiver, and advocate who wishes to know more and do more in spite of a chronic illness diagnosis. Hello. Whether you or someone close to you has received a lupus diagnosis, you likely have questions both about the disease and about the future. Today, I'd like to share with you answers to 10 of the most commonly asked questions of patients and family members who have received a lupus diagnosis. Question number 1. What is lupus? Lupus is a chronic autoimmune disease in which the immune system that normally protects our bodies from viruses, bacteria, and other foreign elements instead attacks healthy tissue, causing inflammation of various parts of the body. Lupus can affect the skin, joints, blood, kidneys, and other organs. There are 4 lupus diagnoses. Systemic lupus erythematosus, or SLE, is the most common, and it's the one most people are referring to when they talk about lupus. Cutaneous lupus erythematosus affects the skin, causing lesions and rashes. Drug-induced lupus erythematosus is a lupus-like disease that can occur as a reaction to a prescribed medicine. What is called neonatal lupus is not a true lupus, but a rare condition caused by a mother's antibodies acting upon an infant while in the womb. While there is currently no known cure for lupus, there are treatments and practices that can help you manage your symptoms and live your best life. Question number 2. Why does it take so long to diagnose lupus? Once a person is diagnosed with lupus, they often recognize symptoms they experienced many months and even years earlier that they see now were part of the disease. In fact, it currently takes an average of 6 years for a lupus diagnosis. That's a long time to not know what's causing you to be sick, and too much time for lupus to go untreated. There are several reasons why reaching a lupus diagnosis is so difficult. The symptoms of lupus come and go, affecting different parts of the body, and they are unlikely to happen all at once. The disease itself is referred to as the great imitator because it mirrors other diseases which your doctor may test for first. Tell your doctor about achy joints, and an obvious response may be to consider arthritis as the cause. Hair loss may be explained as temporary, stress-induced conditions, while fatigue may be blamed on excess weight, advancing age, or being a new mom. But each of these symptoms, achy joints, hair loss, extreme fatigue, is common to lupus. Like many, you may see a dermatologist for a skin rash. The doctor gives you a cream and the rash subsides. If you get sores in your mouth, you may think they're canker sores, and that will go away soon enough. You may ask your dentist about them, but probably not, because chances are you won't have the sores by the time you see your dentist. Who would imagine that having canker sores, and by the way, they are not canker sores, and having achy ankles is somehow related? Well, they are when you have lupus. And if you don't tell your primary physician about all of the conditions affecting your health and well-being, your doctor will not know to test for lupus. Although lupus is more prevalent than multiple sclerosis, cystic fibrosis, sickle cell anemia, cerebral palsy, and AIDS combined, it remains largely misunderstood by most people, and this contributes to delayed diagnoses. You are the key to your doctor's ability to accurately diagnose and treat your unique symptoms. Question number 3. What are the symptoms of lupus? Joints may become warm, tender, stiff, and swollen. Extreme fatigue for someone with lupus cannot be remedied by getting 8 or 10 hours of sleep. It can be a completely debilitating fatigue, and it can last for several days during a lupus flare. Sun or light sensitivity can cause skin lesions on exposed areas of the skin. This includes what is referred to as a butterfly rash on the face. Everyone loses some hair regularly, but lupus can cause hair to come out in larger swaths all at once. Pain when breathing deeply can be caused by pleurisy, when a lupus patient's immune system attacks the lining of the lungs. Pericarditis, the inflammation of the lining around the heart, can cause chest tightness and pain. Mucosal sores that occur in the nose or mouth usually appear on the hard palate or roof of the mouth. Extreme sensitivity to the cold in fingers, toes, and nose is known as Raynaud's syndrome. Extremities can turn white, then purple or dark red while outside in cold weather, or even inside in air conditioning or in the freezer section of a supermarket. Sjogren's phenomena causes dryness of the eyes and mouth. Brain fog can cause a person to confuse words or forget what they're saying mid-conversation. Brain fog is not permanent, but it can be upsetting. Inflammation of the kidneys, a sign of lupus nephritis, is detected through a blood or urine test or kidney biopsy. Question number 4. My doctor doesn't seem to know much about lupus. Isn't lupus studied in medical school? Lupus is the prototypical autoimmune disease, and yes, your doctor studied the disease in medical school, along with more than 10,000 other diseases. What makes lupus so challenging is that there's no standard progression of the disease. No 2 lupus patients display exactly the same symptoms in exactly the same way, and, as mentioned earlier, lupus mirrors other conditions. By sharing what you are experiencing with every doctor you see, especially your rheumatologist or primary care physician, you can help shorten the time between your first symptoms and the best possible treatment for you. This doesn't end once you receive a lupus diagnosis. Self-advocacy is an essential component of healthy living today and every day. Question number 5. What causes lupus? The cause of lupus is not yet known, but more than one factor appears to play a role in triggering the disease, including environmental factors such as sunlight, stress, certain medications, and viruses. We know hormones play a role because 90% of those who have lupus are women, and most are diagnosed during childbearing age. Problems or inconsistencies in the immune system are being studied in ongoing research. Question number 6. How is lupus treated? The goal of lupus treatment is to relieve symptoms and protect organs. Inflammation that has already occurred is treated with anti-inflammatories such as NSAIDs and steroids. To avoid future inflammation, immunosuppressive drugs, typically used in chemotherapy, may be prescribed. Plaquenil is an alternative non-steroid medication that was first used to treat and prevent malaria. Today, it is also used to treat lupus and rheumatoid arthritis. Plaquenil has been proven successful in making lupus flares milder and less frequent. Only one drug has been developed specifically for lupus in more than 50 years, Benlysta. While it is successful in treating lupus in some, it is not effective for every lupus patient. As you and your medical team consider your unique condition, changes and adjustments may be made, particularly when taking steroids. Taking the lowest possible dose for the shortest period of time is best. All medications have potential side effects. Know what each of your prescriptions is for, what side effects to watch for, and any steps you can take to minimize discomfort. Never stop taking a prescribed medication without first talking to the doctor who prescribed it. Question number 7. How bad will my lupus get? Just as symptoms and treatments vary, so do patient outcomes. Lupus is considered a spectrum disease, which means some people have mild cases while others may be very sick. While you may find it helpful to talk to others you know who have lupus, do not think that their experiences will be yours. There are many factors that influence each person's quality of life, and you have control over many of them. By following the instructions and taking the prescriptions ordered by your healthcare team and adopting daily habits that promote health and wellness, you will have a healthier life. Question number 8. Can I still have children? Will my children have lupus if I do? Years ago, women who learned they had lupus were advised not to have children. But thankfully, medicine and our understanding of the disease has advanced dramatically. Many women with lupus have perfectly healthy babies. As a matter of course, every pregnancy involving a mother with lupus is treated as a high-risk pregnancy, taking all necessary precautions to ensure a successful delivery. If you believe you are pregnant or are thinking of becoming pregnant, see your doctor immediately. If you're taking medication for lupus, that medication may need to be adjusted. As for whether or not your child will have lupus, there is only a 5% chance that your child will have it too. Question number 9. How do I explain lupus to my family and friends? You likely will feel or have felt overwhelmed by this diagnosis, and that's understandable. It may surprise you to know that those who are closest to you will feel overwhelmed as well. Watching helplessly as someone you love suffers the anxiety and challenges of a chronic illness is heartbreaking and frustrating. Open and honest communication is the best way to approach the subject with every important person in your life. Sharing literature about lupus will help answer many questions that you may not feel up to answering initially. That literature is available to you free of charge through the Lupus Alliance of Upstate New York. There are many programs, including this one, to which your family members and friends are invited to accompany you. Learning and discussing with others who walk a similar path is empowering for all. Have a family meeting. Sharing simple needs and allowing family members to volunteer ways that they can help will not only help you, but help your family feel empowered too. Question number 10. What now? Keep a journal, beginning today. The lupus path is a changing one, and tracking your progress, challenges, and thoughts each day will provide you and your healthcare team with valuable insights. Plus, expressing yourself is good therapy. Create a notebook that can hold the following information and take it to every doctor's appointment. Your medical history, results of recent lab tests, names, specialties, and contact information about every doctor you see, appointment calendar, List of medications you are taking and doses. List of any vitamins and supplements you are taking and any alternative treatments. A place to write down questions you have for the doctor so that you don't forget. Take a deep breath. Remember, stress is the enemy. Establishing stress-reducing habits will give you peace of mind and help you feel stronger. There are many ways to manage stress: meditation, breathing exercises, yoga, and many more. Find something that works for you and do it every day. Hopefully you have a close friend or family member in whom you can confide your feelings and needs, so you don't feel so overwhelmed. It's important to let them know from the beginning that you're not asking them to do anything, just listen. We all need a confidant now and then. It's also advisable to have that person accompany you to your appointments whenever possible. 4 ears are much better than 2. Take a 15-minute fun break every day. Solve a puzzle, color, dance, listen to something that makes you laugh out loud. Do whatever makes you smile. Did you know the simple act of smiling at yourself in the mirror, even when you don't feel like it, tells your brain to release healing endorphins? Laughter truly is the best medicine. So spend some time each day treating yourself to some fun. If you have questions, or if you're looking to connect with others on a similar path, contact the Lupus Alliance of Upstate New York. Their goal is to empower you to live your very best